There's a labor crisis, and the labor crisis, especially a clinical labor crisis at this point, this specific variant, the Omicron variant, is putting healthcare workers on the sidelines at a time where we need more healthcare workers. So we heard a lot of questions, a lot of conversations around staffing. How are you addressing this? And I heard CEOs for the first time, really, in my mind, talk about labor supply chain,
Yep.
building a labor supply chain, a lot of creativity being pushed this way. And you're in the cybersecurity space. We talk about the clinical shortage here, and they did talk about that. But I'm talking to CIOs who are saying, look, there's areas within IT that are very acute. I mean, it's really hard to get good staff in certain areas. Do you think some of these things apply? I would assume some of these things apply to what we're doing from an IT staffing standpoint.
Yet we've had a shortage in IT security since the jump.
Yeah.
We've never had enough supply to meet the demand. And we're seeing the demand curve spike so rapidly. And now, again, I'm specifically talking about IT security here across all industries at that. It's not just healthcare. There's such a deep shortage of qualified individuals to help solve these problems. Jump back to the nursing issue and the physician issue, right? The clinicians. Weren't we talking about this 20 years ago? A decreasing shortage of available talent for these fields. Why didn't anybody listen back then? Well, now we're paying the piper, so to speak, for not addressing this issue 20 years ago when we were predicting that shortage. Add in this bad pandemic, now the people who are qualified and working are sidelined because they have to be to recover. We knew this was coming. And I'm not pointing fingers and I'm not jabbing anybody, but this is that classic case of, yeah, that may be a future issue, and we don't need to address it right now. No, you need to address it 20 years ago because we just don't have that labor supply chain right now to solve for this problem that we're faced with today.